Hello everyone, and thank you all so much for taking a few minutes out of your day to join us to learn about the Edinburgh Postnatal Depression Scale, commonly referred to as the EPDS. The EPDS is a validated and reliable screening tool for perinatal depression recommended in the Louisiana Developmental Screening Guidelines and by the American Academy of Pediatrics. My name is Dr. Teresa Northington, and I am the Developmental Screening Coordinator for the state of Louisiana and the Bureau of Family Health, and I will be facilitating this training. To begin, let's take a quick look at the overview for today's training. We will begin with a look into developmental screening, the Louisiana Developmental Screening Guidelines, and the importance of screening for perinatal depression, followed by a deeper look into the actual Edinburgh Postnatal Depression Scale, details and how to implement the screening in your practice. To conclude the training today, we will look at some resources and additional information available to you and your practice. In 2020, the Young Child Wellness Collaborative, an interdisciplinary work group of early childhood professionals from various state agencies, convened to create the Louisiana Developmental Screening Guidelines. These guidelines provide a clear-cut outline of the screening domains as well as the reliable and validated tools to be used to administer the screening. The Louisiana Developmental Screening Guidelines were developed and expanded based on the guidance in the Bright Futures Guidelines released by the American Academy of Pediatrics. In the graphic, you can see the domains listed to the left, which are general development, autism, perinatal depression, social emotional, and barriers to health. On the right side of the domains are the validated and reliable tools recommended for screening use for each domain. Although voluntary, the Louisiana Developmental Screening Guidelines promote not only national best practices, but also support healthcare providers and families right here in Louisiana. Today, we will look at the third domain, which is perinatal depression. To screen for perinatal depression, there are a few recommended tools such as the PHQ-2, the PHQ-9, and the SEEK, but today we will take a look at the Edinburgh Postnatal Depression Scale. Here you can see the Louisiana Developmental Screening Guidelines Periodicity Schedule, an easy-to-use table showing which screenings to conduct at each well-child visit. For perinatal depression, it is recommended to screen the caregiver using a caregiver-completed screening tool at the 1, 2, 4, and 6th month well-child visits. The EPDS can also be administered whenever there is a caregiver or provider concern. For parents, caregivers, and families, providing every opportunity for their child to be and live a healthy life is their number one priority. The health of their child does not solely rest on the child's physical person, but also extends to those providing care. The mental health of a child's caregiver greatly impacts the care they receive. For this reason, among others, screening for perinatal depression is paramount for individuals who may exhibit signs of depression and other symptoms, as well as those who may not. Additionally, when speaking of developmental screening, a best practice for screening children often and accurately is not only in the best interest of the child and family, but also can be the difference in a child's access to the support and services they need. In Louisiana, only 24.3% of parents and or caregivers completed a developmental screening tool compared to the national average of 34.8%. Additionally, 37% of children 0 to 5 years old are at risk for delays in school readiness, and 42% of Louisiana parents report having concerns about their child's development. Why do we need developmental screening? If we look at those statistics, we can see a very great need in the state to provide parents, caregivers, families, and teachers with information to assist these children. That information begins with developmental screening. Having a caring and responsive caregiver is critical to healthy development in a child's earliest years. Experiencing untreated depression can impair a caregiver's ability to care for and interact with their child, leading to impaired emotional, behavioral, and cognitive development in infancy, as well as depression in children and adolescents. Caregiver distress is also a risk factor for child maltreatment, with numerous negative consequences for children across the life course. Earlier identification of caregiver depression and distress allows for earlier intervention, with greater positive impact on child development. The Edinburgh Postnatal Depression Scale is a caregiver-completed questionnaire developed to gather the frequency of depressed mood and anhedonia over the past 7 days prior to the caregiver's visit. The questionnaire consists of 10 items, each designed to assess a specific domain. The EPDS is available in 18 languages and for use between 28 to 32 weeks in all pregnancies and 6 to 8 weeks postpartum for both males and females. The EPDS is a validated and reliable tool recommended by the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists. The questionnaire also qualifies for Medicaid reimbursement, which you will see shortly. The domains of perinatal depression targeted in the EPDS are anhedonia, self-blame, anxiety, fear or panic, inability to cope, difficulty sleeping, sadness, tearfulness, and self-harm ideas. Since these topics are sensitive and can be difficult to bring up with caregivers, reviewing support materials, training videos, and scripts focusing on best practices for sharing results is recommended. Additionally, proactively preparing for instances of patient concerns and unexpected or expected positive results is strongly recommended. Perinatal depression screens can be reimbursed by Medicaid using CPT codes 96160 and 96161. Acceptable screeners for reimbursement include the Edinburgh Postnatal Depression Scale, the PHQ-2, and/or the PHQ-9. The current reimbursement amount is $8.14 in the state of Louisiana. Currently, in the state, House Bill 784 and Act 188 require all hospitals and birthing centers providing labor and delivery services to provide pregnant women and their families with information regarding postpartum depression. Additionally, pediatric healthcare providers must screen the caregiver for perinatal depression using a validated screening tool such as the EPDS, PHQ-2, or the PHQ-9 at the 1, 2, 4, and 6th month well-child visits. Lastly, with the birth mother's consent, the healthcare provider must share the results with the birth mother's primary healthcare or mental health care provider of choice. For more information regarding perinatal depression, legislation, or resources, please visit our perinatal page on the Partners for Family Health website using the link on the screen. Administering the EPDS consists of 3 simple steps. First, having the caregiver complete the 10-item questionnaire. Second, scoring the questionnaire. And third, sharing the results of the screen with the family. Now, let's take a look at each step. The first step is to have the caregiver complete the EPDS questionnaire shown here. Due to the sensitive nature of the questions, it is not recommended that parents complete the screener in a public place like a waiting room. It also may help to preface the questionnaire with a letter or statement conveying that the screening is being administered to all parents in the clinic to preempt uneasiness or anxiety a parent or caregiver might feel about why they are receiving the screen. The EPDS consists of 10 items. The caregiver selects a response from 0 to 3 that best reflects their feeling toward the statement over the past 7 days. The entire questionnaire can usually be completed in 2 to 5 minutes. It is important for the validity of the screening results that the caregiver understands the screener. Please don't hesitate to offer reading assistance or a questionnaire document in another language to better assist the caregiver. The second step is to score the questionnaire. Responses to the questionnaire are scored 0 to 3 based on the severity of the symptoms related to the domain being assessed in each item. Scoring the EPDS is similar to scoring a screener, such as the MCHAT, in that there are various items that are reverse scored. To begin, score items 1, 2, and 4. For these items, if selected by the caregiver, the top box receives a score of 0 and the bottom box receives a score of 3. Next, score items 3 and 5 through 10. These items are reverse scored. That means the top box for these particular items only receives a score of 3 and the bottom box receives a score of 0. Now add both sums together to obtain the end score. Scores range between 0 to 30. Please also make sure to take a look at item 10, which can be a direct indicator of suicidality and should be addressed if a caregiver responds yes or sometimes, regardless of their overall score. Caregivers scoring above a 12 are likely to be suffering from depression and should seek medical attention and be given next steps for a referral for additional care. As with all developmental and perinatal screeners, please advise the caregiver and/or parent that screenings assess risk for depression, but are not a diagnosis. The final step in the screening process is to share the results of the screen with the family and provide resources and referrals as appropriate. Again, because of the sensitive nature of the questions, it is important to communicate results and referrals gently and empathetically. Regardless of the outcome of the screen, sharing screening results presents a wonderful opportunity to engage parents in developmental monitoring and promotion. Vroom is an app created by the Bezos Foundation that provides daily age-appropriate brain-building activities for parents to do with their children. The CDC also created the Milestone Tracker app as a part of their Learn the Signs, Act Early program. The app helps parents monitor their child's development by providing checklists of developmental milestones that parents can fill out at their convenience, with pictures and videos of children demonstrating each milestone and tips and activities to promote healthy development from birth to age 5. Both apps are completely free of charge and are available on both Apple and Android devices. Now that we've gone over the basics of the EPDS, it's important to discuss the process of implementing this and any other screening tool into your practice workflow. Our team at the Bureau of Family Health can provide implementation support and assistance tailored to meet the needs of your practice. The extent and focus of our assistance is entirely up to you. We know that each practice and the communities they serve are different, and our goal is to help you create a sustainable system that works for you. Our technical assistance, implementation support, and assistance request form is the first step toward our collaboration. We collect information on your clinic and staff so that we can better understand how to tailor our assistance to your needs. The back of the sheet lists types of trainings we offer and the different activities we can assist with. This form can be found on our website. The Edinburgh Postnatal Depression Scale questionnaire and scoring guide documents can be downloaded free of charge using the links on this slide. Additionally, this training video, as well as other downloadable resources, can be found on the Bureau of Family Health site, including our developmental screening toolkit. In addition to the downloadable resources on the Bureau of Family Health website, the Louisiana Developmental Screening Guidelines, Family Wellness, and Environmental Resource Tip Sheets host a list of appropriate referrals and resources for both positive and negative screens. This can be found online at the link provided here. Thank you so much for your time and interest in the Edinburgh Postnatal Depression Scale and the Louisiana Developmental Screening Guidelines. For more information about the EPDS, the screening guidelines, or resources and referrals, visit our website at the link provided here, or contact our developmental screening coordinator with questions. Thank you so much for doing all that you do to serve and create a healthier Louisiana for our children and families.